Hi, Megan. Good morning. You paged me. What's going on?
Oh yeah, thank you. Thanks for coming down. I was actually waiting for your phone call back. So I'm calling about Mr. Smith in room 2.
Okay.
Concerned about this patient because I had the CNA go in and do a set of vital signs on the patient, and the pulse ox is low. So
Okay.
patient's pulse ox is only about 88% right now. So I think we need to go in and see the patient. This patient was admitted last evening. I did admit this patient last evening with congestive heart failure exacerbation. And previously the patient does have a history of CHF. Patient told me he's been off his medication for the past couple of days and his diet was not as well at home as it should be. So eating a lot more sodium, not really following those fluid restrictions. So it sounds to me like he's struggling to breathe just a little bit. What do you think we need to do?
Well, I have a couple of questions for you. Do we have any labs?
Yes, labs were drawn. I haven't been able to find them just yet because they just upgraded the system. So maybe in a couple minutes we can sit down and look, but I haven't been able to find the labs yet.
Okay. And other than pulse ox, do we have a full set of vital signs?
No, I haven't actually had a chance to assess the patient because the shift just started, but I know the pulse ox was low. Night shift nurse said vital signs were stable all night. Every now and then pressure would dip just a little bit low because they did restart him on the cardiac meds, which was dropping the blood pressure just a little bit. So like 100/60, but I don't know what his actual signs are right now.
Is he on any oxygen right now?
They told me he was on oxygen. He was on 4 liters from report from the nurse. So I'm assuming right now it's 4 liters and the pulse ox is 88.
And how about oxygen at home? Does he ever wear oxygen at home?
I'm not sure about that. I don't think so.
Okay. Any swelling?
They told me last night he looked generally puffy. I don't know exactly, to what extent. Like I said, I haven't had a chance to assess the patient yet.
Okay. Megan, next time before you call, do you think that you could perform a head-to-toe assessment on your patient, know their full set of vital signs, and also have some lab values for me?
100%. Yeah. Yep.
Okay.
Yep. That's probably what I should have done. You're right. Because you're probably like, well, what am I going to do? I don't know all the information. I need a little bit more.
Rapid response, room 2. Rapid response, room 2.
Rapid response, room 2. Isn't that Mr. Smith, Megan?
Oh my gosh, yes. I wonder what's going on. Let's go. Let's go. We have to go see a patient now.
Yes, let's go.
So Dr. P, you just told me towards the end and to help with this communication that you needed a little bit more from the report that the nurse was giving you. Tell me a little bit more about that. What more could have the nurse done to help you as the physician?
So as a physician, before I come and see the patient, I'd like to have a whole picture. So I'd like to have a set of vital signs. I'd like to know what the most current labs are. And if you assess the patient, if there was anything abnormal.
You're right. So let's just recap. Think about what happened in that short little scenario that we just saw. Didn't have the vital signs, didn't do the assessment yet on the patient, knew that the pulse ox was low, but didn't know, did we bump up the oxygen? What position is the patient in? Anything more than that? What meds did the patient just get? So remember, when you're giving information to a physician or any kind of provider, you want to give succinct details, and you do want to assess your patient because it's always so important to go back and assess your patient first. Before you can give any kind of recommendation or intervention, you have to assess your patient.
And Megan, as the nurse, my communication style as a physician to nurse, how could I improve? What could I have asked or done differently to have better communication between the two of us?
Well, I think the questions that you asked are very appropriate. Just giving some additional guiding information on the information that you need, especially if I'm not as clear as I was in this report. Anything that I was not clear on, ask for additional questions like you did. So I think just continuing to do that would be very, very appropriate.
Thank you. Good morning, Meg. How are you? You paged me. What's up?
Yes, thank you. Thanks, Sue. I was actually waiting at the phone for you to call me back. So I'm concerned about Mr. Smith in room 2. So just a little bit of background. He was admitted last evening from home, first went to the ER and then was admitted for us. I did admit him as the admitting nurse last night. Just a little bit of additional background on him. He has a history of heart failure, came in with an exacerbation, told me at home that he was not using any oxygen, told me at home that he ran out of his medications. So the past 3 to 4 days was not taking his medications, and his diet, he's not been following his diet. So he's been saying he's been eating a lot of takeout food and not really following his fluid restriction. So that's where he kind of ended up and was today. So I got report from the night shift nurse last night. They said he was stable for the most part. Every now and then blood pressure would drop a little bit low because they were, pushing the cardiac meds a little hard just to get him back to baseline. But they kind of played that oxygen titration game where he was, 2 wasn't enough, so they had to bump him up to 4. Last I heard from the night shift nurse was that the patient was on 4 liters. So when I went in to assess the patient this morning, looked like he was struggling a little bit harder to breathe. So even just sitting up at the side of the bed, and we did stand him to urinate, and that made him so much more short of breath. And I noticed that his pulse ox dropped. So right now he's been hanging in about like 88, 89% and was unable to recover. So I did bump him up to 6 right now just to see if that starts to help him a little bit more. Definitely has that conversation dyspnea. It's really hard for him to get his words out. I did listen to his lungs. He does have a little bit of crackles bilaterally, more so posteriorly, like posterior base is more so on the left side. I also, he's got some edema, pitting edema, lower extremities +2 bilaterally, more so around the pedal area, but he does look puffy. He's got that generalized edema look to him as well. He is terrified. He can't catch his breath. So I really feel like we need to maybe give him a little bit of Lasix, maybe even a respiratory treatment would help. I did notice he does have a little bit of an auditory wheeze from time to time as well. So I haven't had a chance to look up more about his past medical history, but I do believe he has a history of COPD and asthma as well. So maybe like a neb treatment could be helpful. Anything else, information you need from me before we go on to see him?
Thank you, Megan. That was a very thorough assessment. I appreciate that. So you said you heard some crackles in his lungs, and his pulse ox is 88, 89% on the 4 liters. I definitely agree. I think we need to give him some Lasix. Thank you for that. Will also help with the swelling, the edema in the lower extremities. Thank you for letting me know about that. How about his labs? Has he had any labs this morning drawn?
He did have labs this morning. The big thing that I noticed is that his BNP is elevated. So okay. Definitely suggested that he is in that acute exacerbation of heart failure right now. So that is elevated. Everything else actually looked okay. I mean, glucose was a little bit elevated, but he said he has not been following his proper diet as well. But everything else seemed to be okay. CO2 was a little bit elevated as well, but nothing really to write home about with the BNP.
Okay, thank you. That BNP, that does collaborate with our thoughts of congestive heart failure and acute exacerbation. So again, Lasix, I absolutely agree, would be an appropriate treatment measure for that. You said he's not on any oxygen at home. He was on 4 liters overnight, and you've now bumped him up to 6 liters. Does it seem to help?
A little bit, but the moment that he moves, it's just he cannot recover. He's having a really hard time recovering from that. So like you had said with the Lasix, and from my recommendation, I really think we just got to get some of that fluid out of him, just diurese him a little bit.
Thank you. Thank you. You painted a very good picture of what I can expect to see when I walk into the room. How about we go and see Mr. Smith together now?
Okay, great. Thank you. Let's go. So everybody, you could see from that second scenario that you just showed that proper communication was used. So the nurse, the role that I was playing, and well, I am a nurse, but the role that I played in this scenario as the nurse for Mr. Smith, you saw that SBar was followed appropriately. And the communication was short, concise, sweet, the information that we needed to, and also the nurse was able to respond appropriately to the questions that the physician had. And there was that collaborative piece there at the end where they're going to go in and assess the patient together. And both had a very clear understanding of each other's roles and what we needed to do next.
So our key takeaways for today's SBar communication would be to utilize proper communication techniques, to gather patient data such as assessments and labs prior to initiating your interdisciplinary collaboration, and be prepared to provide patient information in a clear, concise SBar format and answer associated questions.
Well, that's enough from us. I'm Professor Megan Shattuck, Assistant Clinical Professor with the BSN Nursing Department.
And I am Professor Genevieve Parecka, a Simulation Education Specialist here in the College of Nursing and Health Professions.
Thank you for your time. We appreciate you listening to this presentation.